It's been another great year for teamwork at the RUH and our absolute focus on serving our patients. We came together to work on new and improved projects and services. We collaborated on those day-to-day activities that make our hospital tick. And we united against the unexpected, like the snow back in March. All of you here tonight represent the very best of our team RUH. Whatever your role is, you've made a big difference, and I want to say a really big thank you. That's on behalf of the Board of Directors, colleagues from around the Trust, and most of all, on behalf of our patients. Thank you.
The name of our team is the Paediatric Demand Management team. The reason we won Team of the Month was for developing a different way of managing referrals into paediatrics. The reason we needed to do this was to meet the ever-increasing demand for referrals, both for inpatient admissions and for outpatient appointments. And we felt that if we could do things a little bit differently, that we could offer a better service that was more flexible and more responsive, and that it would meet the needs of our patients and families better, but also meet the needs of our GP colleagues and primary care colleagues that are referring to us. We're really proud that we've been able to introduce this project, and with the hard work of consultants, admin staff, managers and data analysis, we've been able to prove that there's a really effective way of managing referrals that is ultimately better for our patients and families, it's better for the GPs, and it's also using the hospital resources more efficiently.
The name of our team is the Catering team. We won Team of the Month for the changes we made to the patients' menus that enabled us to achieve a Soil Association Food for Life award. The Food for Life award demonstrates our commitment to serving freshly prepared, healthy, nutritious meals for our patients using foods that are seasonal, locally sourced, farm assured and sustainable. The thing that's changed for the kitchen is we used to use predominantly frozen foods, and we've moved to freshly prepared foods. So for example, if we're making cottage pie, then we're buying in farm assured fresh minced beef, and it's being made freshly in the kitchen for service on the lunchtime. We've had some really positive comments from patients that we received through the Friends and Family Test comment cards.
The name of our team is the Gynaecology Outpatients department. So the reason we won Team of the Month was because we introduced a new surgical service for our women who sadly have miscarried. This meant that they had more choice and were able to manage what was happening to them, which is obviously quite devastating sometimes, in the best way for them. What we introduced is something called MVA, which is a surgical procedure which can be done quite easily and simply in most cases in our outpatients department, and this meant that our ladies were able to come in and go home much more quickly than the way that we do this traditionally, and it gave them more choice and allowed them to be at home with their families as soon as possible. We were able to do this because the Innovation Panel very kindly gave us the ability to introduce it by supporting us, which we're really grateful for. We were able to audit this, and the women that participated and who wanted MVA found that it was really beneficial.
The name of our team is the Oncology team. This includes the clinical oncologists and haematologists. It also includes the radiotherapy physicists and the therapeutic radiographers, the chemotherapy nurses and the oncology and haematology pharmacists, also the William Budd medical and nursing staff. The reason we won Team of the Month was because of our urgent response to the fire which broke out on the 10th of May at the Bristol Haematology and Oncology Centre. They had to evacuate their site for several days, which meant that the patient's treatment would be compromised, and we just wanted to offer whatever help we could to reduce the impact on the closure on their patients. So we offered assistance and support for radiotherapy patients whose care and treatment was time critical. And we also took over the care for the patients undergoing intensive chemotherapy and stem cell transplant. Thankfully, we've never experienced a situation like this before, but it did mean that we all had to work really hard as an oncology team to come up with the complex treatment solutions.
name of our team is the Pulmonary Hypertension team. So the reason we won Team of the Month was that we had a really good outcome from a new national peer review process last year. So pulmonary hypertension is a rare condition. It's a condition where we can make a massive difference to patients with new treatments and new interventions that have come out. Because it's a rare disease, the services tend to typically be in large teaching hospitals, and there's only about 6 or 7 of these big units across the UK. So we set up a shared care service with London, and now that's grown, so we treat people from a catchment area of 4 million across the whole of the southwest. The service has really come on leaps and bounds. It involves several specialties across the hospital, and it was great to be recognised with the peer review process last year, where we came out in one of the top 3 services out of 21 throughout the UK.
The name of our team is the Finance and Procurement team. The reason we won Team of the Month is because over the last 12 to 18 months we've gone through a period of quite significant change with our senior leadership and changes within the senior management team. But during this time we've still managed to deliver with all our deadlines, to make sure that we've hit our regulated deadlines and to keep control of the financial position at a time that's been particularly challenging for the whole NHS. As a team, we sit quite far out from the rest of the hospital, and it's great to feel that we'd be valued by everyone else, and the work that we do to support the clinical teams in doing their jobs is something that's recognised and appreciated. And we've also looked at very innovative ideas of delivering our savings programme through looking at things like the model hospital and lots of the benchmarking data available. So we're not just giving people a target, we're actually using information out there to try and help them.
The name of our team is Endoscopy. The reason we won Team of the Month was because we carried on providing excellent patient care despite the fact that there was increasing demand on the service, and that continues year on year. We see in excess of 10,000 patients a year, and each year that demand increases, and there are only so many hours in the day, so it was about the team being creative. How could we use the day as well as we possibly could by being efficient, by being innovative, extending the day slightly, working weekends, introducing new services, alternative services, and essentially all pulling together. And during that time, interestingly, even though we had that increasing pressure and increasing demand, we managed to maintain the quality. The level of complaints from patients didn't go up. In fact, we barely saw any. And also we had increasing compliments despite the pressure we were under.
The name of our team is the 100,000 Genomes Project Consenting Team. The reason we won Team of the Month was we were a group of nurses working collaboratively with a multidisciplinary team. That's doctors, nurses, laboratory staff, comms team, NHS England, on a project that was nationwide. It was called the 100,000 Genomes Project. We were recruiting from the public DNA samples to inform the biggest laboratory storage in the world. That's belonging in England. We are so excited to be part of this groundbreaking project.
The name of our team is Urology Outpatients. The reason we won Team of the Month was we were having decontamination issues with our flexible cystoscopes, and it led to a patient backlog. We identified their clinical risk and prioritised them to have their diagnostic test. At the same time, we had 374 flexible cystoscopies that were accruing because we were limited with only 10 scopes a day. The team worked tirelessly over weekends, evenings, just to try and clear the backlog, which we managed to do. And as of today's date, we don't actually have any backlog, which is absolutely amazing. So urology have been the first surgical speciality to achieve the RTT 92% target, which is a referral to treat target. I'd really like to thank the team for all their hard work and efforts in helping us to achieve the targets that we've achieved so far this year.
The name of our team is the Radiology Redevelopment Project team. The reason we won Team of the Month was we've just undergone a major redevelopment project in the Radiology Department, which involved creating new spaces for the Trust's third CT and third MRI scanners, and also redeveloping patient waiting areas. We needed to improve the flow around the department because we were two separate areas and we were being joined into one area, and we needed to improve our efficiency. Under normal circumstances, we would have decanted to a new area while the work was going on, but because our equipment is large fixed equipment, we couldn't move out. So for the first time ever, the Trust had to do an enormous building project in a busy live clinical area. The building work lasted just over a year, and the whole department really pulled together and were absolutely amazing in coping with the difficult working situation that we were in. We were really proud of the fact that not a single patient appointment was cancelled during the building work in that year-long project.
The name of the team is the Academy Library. The reason we won the Team of the Month was for the audiobooks for Dementia Patients project. Dementia patients needed more activities to help keep them stimulated and engaged. After having funding from the Innovation Panel, we were able to purchase around 10 audiobook players and buy associated equipment like headphones and a subscription to a streaming site. We receive requests from the dementia wards, and then we download listening services like audiobooks or radio programs or plays that might suit that patient. We demonstrate either to the patient or the family members or ward staff how to use the players, which are dementia friendly. It's given us an opportunity to work together as a team and also to contribute to the Trust's dementia agenda and directly work with patient care.
The name of our team is the Respiratory Ward. The reason why we won Team of the Month in December was for the two weddings that we coordinated on the Respiratory Ward for two of our end-of-life patients. We knew it was actually going to happen the day before. We were able to arrange posies of flowers, wedding cakes to be brought in. One of the weddings was in a side room and the other wedding was in our quiet room, so the teams were able to decorate those rooms. And we also liaised with chaplaincy and with the Art of the Heart team. So we felt this was really important because this is part of the patient care. It's listening to patients' wishes. It's having those sort of, those conversations with patients. We've realised that this was a really important thing for them to do. The fact that we were able to fulfil this with the support of the other teams around the hospital, we felt really proud that we were able to do this. We were able to value those wishes and those concerns of the patients and their next of kin.